Part B of Maternal Health and SIDS Prevention in Northern California. The 2011 American Academy of Pediatrics recommendations have been expanded to focus on safe sleep environments that can reduce the risk of all sleep-related infant deaths, including SIDS. Infant care practices outlined in the expanded recommendations include placing infants to sleep on their backs, on a firm sleep surface, breastfeeding, room sharing without bed sharing, routinely immunizing infants, using a pacifier and avoiding tobacco smoke and overheating. Since the implementation of Safe to Sleep campaign, there has been a noted decline in infant deaths due to. Here are the rates of sudden infant death syndromes for California residents from 1992 and 2012, and for the United States from 1990 to 2010. This chart shows the breakdown of sudden unexpected infant deaths by causes in 2011. The majority of cases, 56%, were categorized as sudden infant death syndrome, followed by unknown causes at 26% and accidental suffocation and strangulation in bed at 18%. Here is a breakdown by counties prepared by the California Department of Public Health with number of SID deaths, total number of live births, and SID death rates for each county for California residents from 2010 to 2012. As you can see, every county here in California has a PHN as liaison for the California SIDS program. In areas in California where community need is greater, there is more than one PHN to handle the population's needs. Sudden infant death syndrome, SIDS, and sudden unexplained infant death syndrome have occurred throughout time and have affected many societies regardless of race, religion, financial and social standing, or geography. Here are Healthy People 2020's target reduction rates for infant deaths caused by SIDS. In California, it was reported that 164 infants died from SIDS in 2012. The number represents a rate of 32.6 in infant deaths per 100,000 live births, which is an increase of 1.6% from 2011. This in turn is a decrease of 29% from 1999 when SIDS rate was 45.7% per 100,000 live births, showing that overall, not only did California meet Healthy People's 2020 target reduction rates, it surpassed it by 3.1%. The assurance function. Part of the assurance function is to make sure that policies and procedures are being followed. Enforce. Example, in 2011, the American Academy of Pediatrics released a policy statement, SIDS and other sleep-related infant death, expansion and recommendations for safe infant sleep environment, and an accompanying technical report. The Safe to Sleep campaign, formerly known as Back to Sleep, aims to educate parents, caregivers, and healthcare providers about ways to reduce the risks of SIDS and other sleep-related causes of infant death. The Safe to Sleep strategies outlined in the Safe to Sleep materials and publications are based on recommendations defined by the 2011 AAP recommendations. Targeted outreach to MCAH population, other public health programs and providers, increase knowledge of parents of newborns and child care providers, birth hospitals, midwives. To assure, have discussions. Ask what sleep positions they had as infants or they used with their babies. Talk about conflict with women in their 50s and older who were taught to always put babies to sleep on their stomach. Lecture, review and discuss sudden infant death syndromes. Practice, communicate the policies regarding sleep position and why to parents. Question and answers. Respond to any questions that the group may have. Ask questions and emphasize important points that highlight the main concepts. Evaluate. In order to evaluate the effectiveness, accessibility, and quality of personal and population-based health services when dealing with SIDS, short and/or immediate objectives must first be set. After that, input is necessary as well as intervention activities to meet the objective. When the evaluation portion of the assurance function can take place. Performance measures should include process description and measures and outcome measures. Develop and implement a continuous quality improvement, quality assurance process to monitor implementations of policy processes. A regular feedback mechanism to continually improve the process and evaluate the impact as well as provide technical assistance as needed. Policy development actions, existing policies. Both the CDC and the National Institute of Health collect info on sudden unexpected death from people 19 years and younger. American Academy of Pediatrics, the educational website Healthy Children, Divisions of Reproductive Health investigates SIDS cases. CDC research to improve collecting data and reporting of SUIDs. SIDS state mandate California Department of Public Health by the California Department of Public Health. Training for emergency personnel and public health professionals. Public development actions, community specific. August 13, 2003, Governor of North Carolina signed a bill, law put into place mandating all children care providers to put babies on their back when placing them to sleep. NC prevents SIDS laws have been effective since December 1, 2001. Monitor sleeping babies, adopt a written safe sleep policy, inform parents about safe sleep policies, receive SIDS training. Policy development actions, new policies, national laws in place for all child caregivers and facilities, non-profit educational seminars for caregivers, parents, and any facility employed involved with infants. Stakeholders and facilitators, governors supported for SID laws, California SID Advisory Council. 9-member state-appointed team advises public health issues related to SIDS. Dr. Thomas G. Keynes, SIDS researcher, holds the council chair. All of this is to help further assist with providing information as well as enforce regulations and standards to follow regarding SIDS. Various organizations and programs have also become involved in educating the public as well. Policy development actions, public health essentials. Inform, educate, and empower. Training academies for emergency personnel, public health professionals, caregivers, parents, etc. in place. Training in place for medical examiners, law enforcement, and child advocates to enforce the law with communities. Councils in place, governors support the law and sign bills to create all laws for SIDS. Research is continuous by the CDC and the APA and other known agencies to create more policies to prevent infant deaths. Sudden infant death syndrome, SIDS, and sudden unexplained infant death syndrome is not conditions that are easily diagnosed with a specific cause or narrowed to specific demographics. However, with utilization of the 10 essential services, research continues to shed new light onto what might be the possible cause of infant deaths due to SIDS. Research through the University of Adelaide conducted a worldwide study where they compared 176 children who died from head trauma, infection, drowning, asphyxia, and SIDS. Researchers were looking at the presence of a distribution of a protein called B-amyloid, precursor protein, otherwise known as APP, in the brain. This APP staining, as it is known, could be an important tool for showing how children have died. This has been the detailed study in SIDS cases by the University of Adelaide 2014. This is just an example of how there might be a possible explanation in ed to SIDS in the near future, with the continued utilization of the 10 essential services. It was with the application and utilization of 10 essential services by the Public Health Department, the CDC, and those organizations who choose to be involved with SIDS reduction that such campaigns as the California SIDS program and Back to Sleep campaign have been successful here in California. Our reputation for success in SIDS reduction is one that has the rest of the nation turning to us to see how we have done it. Our approach has set a higher expectation in SIDS reduction and has become an example of how to run similar programs in other states. There are over 17 different programs and organizations here in California, all dedicated to SIDS reduction. There is a high level of communication between these organizations, the CDC, and local public health officials here in California. To make this level of communication possible, as well as to make sure each county has access to these resources and information, there is a public health nurse in each county running a SIDS program for the local community. References and references concluded.